Hi, I'm Raymar B. Calyado from Section Weidenbach. For this video, I will perform Hot Sitz Bath. But first, what is Hot Sitz Bath? It is a local application of moist heat in which the buttocks, lower trunk, pelvic area is immersed in warm water. It can help relieve pain and discomfort in the perineal area, such as after childbirth or surgery, and can increase circulation to the tissues, promoting healing. For the assessment, review any orders related to the sitz bath. Determine patient's ability to ambulate to the bathroom and maintain sitting position for 15 to 20 minutes. Inspect perineal or rectal area for swelling, drainage, redness, warmth, and tenderness. Assess bladder fullness and encourage patient to avoid before sitz bath. For the objectives, first, to relieve congestion in the pelvis. Second, to relieve tenesmus and effectual and painful straining at stool and in urinating. Third, to relieve painful hemorrhoids. Fourth or last, to relieve pain after cystoscopy, vaginal hysterectomy, vulvectomies, excision of the vulva, episiotomy during the childbirth, and hemorrhoidectomy. For the equipment used for this procedure are sitz bath basin, bath towels, pitcher of hot water, ice cup, hot water bag, clean gloves optional.
Step 1. Check physician's order for sitz bath. Step 2. Identify the patient. Positive identification of patients is essential to ensure the intervention is administered to the correct patient. Step 3. Explain the procedure. Explanation relieves anxiety and facilitates cooperation. Step 4. Close curtains around the bed and close door to room if possible. This ensures the patient's privacy. Step 5. Perform hand hygiene and put on clean gloves. Hand hygiene deters the spread of microorganisms. Gloves prevent exposure to blood and body fluids. Step 6.
Assemble equipment in the bathroom. Organization facilitates performance of tasks.
Step 7. Raise lid of toilet. Place bowl of sitz bath with drainage ports to rear and infusion port in front in the toilet. Fill bowl of sitz bath about halfway full with tepid to warm water. Sitz bath will not drain appropriately if placed in toilet backwards. Tepid water can promote relaxation and help with edema. Warm water can help with circulation. Step 8. Remove the patient's clothing and any dressing that are present. Assess the area being treated. Step 9. Clamp tubing on bag. Fill bag with same temperature water as mentioned above. Hang bag above patient's shoulder height on or IV pole. If bag is hung lower, the rate of flow will not be sufficient and water may cool too quickly. Step 10. Assess patient to sit on toilet and provide any extra draping if needed. Insert tubing into infusion port of sitz bath. Slowly unclamp tubing and allow sitz bath to fill. If tubing is placed into sitz bath before patient sits on toilet, patients may trip over tubing. Filling the sitz bath ensures that the tissue is submerged in water. Step 11. Clamp tubing once its bath is full. Instruct patient to open clamp when water in bowl becomes cool. Ensure that call bell is within reach. Instruct patient to call if she feels light-headed or dizzy or has any problems. Instruct patient not to try standing without assistance. Cool water may produce hypothermia. Patient may become light-headed due to vasodilation, so call bell should be within reach. Step 12. Place a cold compressed ice cup at the back of the neck or on the head. To help alleviate feeling of weakness, less amount of blood in the head will cause to faint and ice cup is applied to cause the blood vessels to constrict so that the blood will remain on the head. Step 13. When patient is finished in about 15 to 20 minutes, help patient stand in gently pat perineal area dry. Assess patient to bed or chair. Ensures that call bell is within reach. Patient may be lightheaded and dizzy due to vasodilation. Patient should not stand alone and be bending over to dry self may cause patient to fall. Step 14.
Empty and disinfect Sitz Bath bowl according to agency policy. Remove gloves and perform hand hygiene. Proper equipment cleaning and hygiene deters the spread of microorganisms. For the evaluation, first, increase circulation occurs to the affected area. Second, increase warm occurs to area of application. Third, suppuration progresses. Fourth, pain is decreased with heat application. Recording and reporting, record procedure on patient's chart, date and time bath was given, temperature of water, duration of bath, effect and reaction of patient.